Good morning all. Today we are discussing about atraumatic restorative treatment. Dental caries is a major public health problem and treatment of dental caries includes restoration. But this restoration requires motor-driven instruments, electric supplies and a dental setup. But some communities where few dental facilities and providers are available and alternative measures for treating caries is being developed. That is known as atraumatic restorative treatment. This ART or atraumatic restorative treatment uses only hand instruments and a tooth adhesive material is used for restoration. This ART is practiced in 1980s in Tanzania. It is also known as alternative restoration technique by that term is coined by American Academy of Pediatric Dentistry. This ART or atraumatic restorative treatment is based on minimal intervention, minimal invasion, and minimal cavity preparation for the caries lesion. So ART is the dental caries treatment procedure involving the removal of soft demineralized tooth tissue using hand instruments alone, followed by restoration of the tooth with an adhesive restorative material, routinely glass ionomous cement. So what does atraumatic mean? Atraumatic means it is causing minimal trauma or no pain. In terms of pain, this atraumatic procedure uses only hand instruments and it does not cause any pain to the patient. So it doesn't require local anesthetic administration. To the tooth, the conservation of sound tooth tissue is done as much as possible and it is minimal traumatic procedure to the pulp. So any trauma experience is less than when compared with other invasive techniques. This ART is practiced or pioneered in Tanzania as a part of community-based primary oral health program in 1980s. This ART, the technique is adopted by WHO in 1994 and it is adopted by FDA in 2002. Principles of ART that is removing carious tooth tissue using hand instruments alone and restoring the cavity with a restorative material that sticks or that chemically bond to the tooth structure, and usually glass ionomous cement is used as the restorative material. Why are we using hand instruments? Because the restorative care to make the restorative care accessible for all population and conserves the sound tooth structure as much as possible, low cost, limitation of pain, simplified infection control. These are the reasons why we using only hand instruments. And reason for using glass ionomous cement is the cement chemically bond to the tooth structure. That is both enamel and dentin, it will form a chemical bond. So conventional cavity preparation method steps are avoided and fluoride is released from the glass ionomous cement from the restoration. So this released fluoride will prevent further progress or development of caries. And glass ionomous cement does not inflame or irritate pulp or gingiva. Indications of ART, that is caries involving dentin, and the cavity should be accessible to hand instruments, limited access to traditional care. The population is not having access to traditional care or traditional dental setup, pediatric and geriatric patients, higher caries risk management, and extreme dental fear or anxiety management. Especially the pediatric population, sometimes the child may not allow the use of motor-driven instruments such as air rotors. In such cases, we can practice ART. Contraindications: if the tooth is with swelling of fistula, pulp of the tooth is exposed, or teeth is painful for a longer period of time, or mouth opening is restricted, like in Christmas cases, we cannot use use hand instruments to access the tooth and prepare the tooth. In such cases, we cannot use ART. Coming to armamentarium, the instruments used include mouth mirror, tweezer, explorer, spoon excavators, both small size and medium size, dental hatchet, then mixing pad, spatula, carver, applicator or cement carrying instrument, and light source. Materials include petroleum jelly, wedges, plastic matrix, clean water, gloves, cotton rolls or cotton pellets, and of course our glass ionomer cement. Usually type 9 glass ionomer cement is used for ART restorations. Coming to the technique, first operating position and lightening. The operator should sit firmly on the stool with a straight back, thighs parallel to the floor, and both the feet should be flat on the floor. Most commonly, we use direct rear position or right rear position. Direct rear position means 12 o'clock position and right rear position is 10 o'clock position. The seating position of assistant is at the left side of a right-handed operator. Then patient position will allow the patient to lie on the back of a flat surface such as a bamboo or wooden bed or a table. And headrest can be used that is made up of foam or rubber ring with a cover. Then operating light. Usually we can use natural light source or artificial. Natural light source means direct sunlight we can use. And artificial light is more reliable and constant. And we can focus that artificial light into a particular spot. So artificial light is more recommendable than the natural light source. That artificial light source like portable light source like headlamp, glasses with a light source or a light attached to mouth mirror extra can be used for the ART. Next is the important step is isolation. For the longevity of any restoration, salivary contamination should be avoided. So in ART, we are using cotton rolls for isolating the tooth. Then coming to preparation of the cavity, where we are using only hand instruments. First, we have to remove the plaque from the tooth surface or debris if present, that should be removed. That we are done using a wet cotton pellet. Clean the tooth surface using a wet cotton pellet and then use a dry cotton pellet to dry the surface. Then enter the cavity using a hatchet. The entrance is made wide using hatchet, blade placed in the cavity and rotating or by backward and forward motion of the hatchet. If you are turning the hatchet like a key in the cavity, all the unsupported enamel will be broke off and we can remove that broken pieces of enamel. The cavity is very small. We can use the corner of the blade and enter the cavity by turning the hatchet. Then the soft caries dentin and that is infected dentin we can remove using excavator by circular scooping movements along the long axis of the instrument. We have to clean all the walls of the cavity and then the caries or the infected dentin should be removed from the floor of the pulp. The cavity walls should be cleaned for proper bonding of our restorative material. So if there is any overhanging enamel or unsupported enamel, which can be removed using the blade of a hatchet. Once the cavity preparation is over, we have to clean the prepared cavity. That is using cotton pellet, we can clean the cavity and dry the cavity using dry cotton pellet. Then we have to condition the cavity. For conditioning the cavity, usually the liquid supplied with glass ionomer is used as the conditioner. That glass ionomer liquid is applied onto the cavity and then wash the cavity and dry the cavity. Next is restoration of the cavity. For the restoration, we are using glass ionomer cement. And we have to mix the glass ionomer cement in mixing pad using spatula, and a smooth, glossy mix should be available for restoration. Carry the restorative material to the cavity using either cover instrument, or we can use plastic carrying instrument. And once it is applied to the cavity, then take a small amount of petroleum jelly on the index finger of a gloved hand and press the material firmly into the cavity and fissures. After applying pressure, then check for occlusion by asking the patient to bite the tooth. And again recheck the filling, and excess material should be removed, and ask the patient again to bite. And after that, after complete removal of excess material, cover the restoration with a new layer of petroleum jelly and instruct the patient not to eat or drink for at least 1 hour. Applications of ART. It is introduced for economically less developed population where dental facilities or dental care is not reachable for all the people in a population. Then introducing dental care to very young children not previously exposed to dentistry, or patient with extreme fear or anxiety where we cannot use motor-driven instruments. Then mentally or physically handicapped patients and homebound elderly, those who are living in nursing homes where we cannot shift such patients to a dental operatory. In such cases, we can go for ART. Advantages. Use of easily available and relatively inexpensive hand instruments. It does not need any motor-driven instrument, or it does not need burrs or aerota, etc. Only hand instruments are used. It's a biologically friendly approach because the tooth structure is conserved as much as possible. It is a minimal intervention technique. And there is no pain, so no need of local anesthesia. Simple infection control practice, and this glass ionomer cement is chemically adhered to the tooth structure, so the sound tooth structure can be preserved. No cavity design, particular cavity design is not needed since the material is chemically adhered to the tooth structure. And fluoride is leaching from glass ionomer, so this fluoride will prevent further progression or further development of caries, and it is easy to repair the defects if it happens, and of course low cost. These are the advantages. Coming to limitations. Long-term survival rate of glass ionomer ART restorations are not available, and the technique acceptance by oral healthcare professional is not yet assured because the removal of caries dentine or infected dentine, and it is not confirmed by it's not we are not using any motor driven instrument, so the removal is questionable. The complete removal, whether the complete removal has happened or not, it's a questionable thing. And then hand fatigue, because we are using hand instruments, and for a CAM patient or for the larger population, if you are using for all patients, then hand fatigue is more common. Then limited to a small or medium sized one surface lesion. But ART is very advantageous for a underdeveloped population, and it has the potential to make oral health care available to larger part of the world or population. But emphasis should be done on preventive measures as well. So coming to the conclusion, ART is, as the name suggests, it causing minimal trauma and no pain to the patient. And we are conserving as much as tooth structure possible, or sound tooth structure is conserved. It is based on minimal intervention technique. And we are using hand instruments for removing the caries. So that is the most important feature or peculiar feature of ART, that we are using hand instruments to remove the caries. And we are using a material that is chemically adhesive to the tooth structure, that is glass ionomer cement. This glass ionomer cement restoration got another advantage is that it will release fluoride, and that fluoride will prevent further progression of caries or further development of caries in the oral cavity. We are using mainly enamel hatchet and spoon excavators to clean or to prepare and clean the cavity. All the cavity walls should be cleaned before doing the treatment, doing the restoration, and all the overhanging or unsupported enamel should be removed before doing a restoration. And once the cavity is filled, then we have to protect the restoration using a petroleum jelly. This is all about ART. Thank you.